Hi Maria, my name's Kylie. I'm going to be your nurse today. How are you doing today?
I'm okay.
You're okay? Okay, well what we're going to do today is, since this is the first time we're meeting in the outpatient clinic right now, I kind of want to just get a baseline assessment, cover a lot of different things, and check up on you, see how you're doing. Is that okay? Okay. What we're going to talk about today is completely private. It's completely confidential. I'm not going to tell anyone unless it involves the safety of a child. Does that make sense? Okay. All right. So what I want to talk about today is we wanted to check up on you and see how you were doing. I know you had a recent hospitalization, and I wanted to see how you're feeling. So could you tell me a little bit about what's been going on lately, how you're feeling, and stuff like that?
Well, I was in the hospital because of depression, but I've been feeling a little bit better since then, so I'm just here for my outpatient therapy.
Okay. How do you feel about going to outpatient therapy? Do you feel optimistic and fine? Okay. And I noticed that you have some bruises on your arms right there. Do you think that you could tell me a little bit about that if you're comfortable with it?
Well, a couple of weeks ago, I decided to go back to school, and so I rolled up and picked up my books. But I didn't talk to my husband about it first, and he didn't agree with that decision, and we got in a fight about it.
Okay. Have you had any treatment for the bruises? Have you seen a healthcare provider?
No, it's just bruises.
Just bruises, okay. All right. Were you in pain because of it?
A little bit.
All right. Well, I have some questions for you. It's just part of this baseline assessment, these are questions that I ask all of my patients. It's completely standard. And what it is, it's about intimate partner violence. And the reason we ask all of our patients about this is because it's very common. 1 in 5 women experience interpartner violence. 1 in 17 men do. So it's just something that, as healthcare providers, we're very responsible for and we can look out for. So is it okay if I ask you some questions about that? All right. So right here I just have a tool. It's a screening tool. I ask these questions specifically to all my patients, and you just answer as best you can and answer what you're comfortable saying, okay?
Mm-hmm.
Okay. All right, the first question is, in general, how would you describe your relationship? Would you say there's a lot of tension, some tension, or no tension?
A lot of tension.
A lot of tension, okay. Do you and your partner work out arguments with great difficulty, some difficulty, or no difficulty?
Great difficulty.
Great difficulty. Do your arguments ever result in you feeling down or bad about yourself?
Sometimes.
Do arguments ever result in hitting, kicking, or punching? Is that often, sometimes, never?
Sometimes.
Sometimes, okay. Do you ever feel frightened by what your partner says or does? Often, sometimes, never?
Sometimes.
Sometimes. Okay, has your partner ever abused you physically? Often, sometimes, never?
Sometimes.
Has your partner ever abused you emotionally? Often, sometimes, never?
Never, I guess.
Never, okay. Okay, and those are all the questions for it, so easy, you're done. So what I'm kind of getting from that is that you feel like there's some tension in your relationship with your partner, and that sometimes it affects you emotionally, and sometimes it affects you physically. And do you have anything that you want to add to that, or do you want to talk about, about how that feels?
I mean, I should have asked him first, and he stopped when I said I was sorry, so.
Okay. Well, I just don't think that anybody deserves to feel bad. You don't deserve to feel bad about yourself. And, you said you had children, right? Yeah, you're the mother of 2 kids, and so everybody's doing the best they can. And I wanted to tell you, is it okay if I talk to you about some methods for safety in your relationship? Is that okay? If not, that's totally fine. It's up to you.
Sure.
Yeah? Okay. Well, and this is just to help you feel better and help you feel safe, maybe decrease some tension, decrease anxiety. So some things that you can do for yourself is to avoid rooms without exits. That way you always have options on how to get out of a situation. Avoid rooms with weapons such as the kitchen when you're in an argument or a fight. Maybe create a list of people you can talk to. You can call at any time. Have a couple phone numbers memorized of people that are there for you. And one phone number you can memorize is our phone number, because we always have a safe place for you. Here is always a safe place. And I have a resource card here. It has some hotline numbers. It has some information, tips for you. And, or if you know anybody that could also benefit from this information, you can share that with them if you feel like they need to know that. So, I'll give you that. And it's really little. You can just stick it in your purse, keep it with you like that. So the only reason I'm talking about this, I just have concerns for your well-being and want you to be back, feel at your optimal level of comfort and feelings. Do you have anything that you want to add, discuss? Do you have any questions?
I don't think so.
No questions? Okay. All right. Well, what we're gonna do is, I want you, anytime you have any concerns about anything, about you, your children, anything like that, you call us. We have a hotline 24/7. You are always welcome here. You can always bring your kiddos here. We have a safe place for you, or if you just need to call, talk, you need information or something like that, of course we're always here. So I am gonna step out of the room. We're gonna get some more stuff, finish your assessment up, and hopefully we'll finish your appointment and get you out here, okay?
Okay.
All right, thanks.
Thank you.